Hi, Dr. Campbell. My name is Matthew Smith, and I had case 4. So, after reading the history and the tests and measures, the red flags I came to find were that the patient had an unusual BP vital sign, with the diastolic blood pressure being 45. Severely low would be below 60. The patient recently had a history of trauma with a fall in hockey, and then the symptoms were out of proportion to the mechanism of injury. He had abdominal pain, and then he also had left shoulder pain. And you usually don't see abdominal pain days after just a regular fall on the shoulder. And then I said that the shoulder pain accompanied by the full and painless range of motion would be a red flag. And then the pain pattern being described as deep and aching would be a pain pattern. The 3 systems I chose would be, one would be the cardiovascular system. I thought this because the diastolic blood pressure is severely low, being 45 millimeters of mercury, and this could possibly be causing the lightheadedness. My second system I hypothesized would be the neurological system. The patient complained that he was foggy post-incident, and since he was playing hockey and took a hard fall, I'm thinking there could be a chance of a concussion. My last system that I hypothesized would be the gastrointestinal system. In the history, the patient complained of abdominal pain with nausea, and then on the tests and measures, there was deep palpation that recreated the left shoulder pain. So I thought that could be a referral. The questions that I would ask related to each system that I hypothesized. So for neuro, I would ask them if they recently experienced any dizziness, if they recently experienced any unexplained confusion, if they recently experienced any headaches, and then if they recently experienced a loss of memory. I would ask these questions based off of their complaint of fogginess and try to get more information if a concussion is in play or if I can rule out a concussion. My questions for gastrointestinal, I would ask them if they have been experienced any vomiting lately. Regarding their abdominal pain, I would ask them if there are any positions that alleviate the pain, and then I would clarify to ask if lately they've noticed any blood in their stool. These questions could lead us to possibly hypothesizing about any internal bleeding that may be going on. And then my last system would be cardiovascular, and the questions I would ask would be if recently they've experienced any loss of consciousness, if they recently experienced malaise or feeling lethargic, and then if they recently experienced any labored breathing. I would want to ask more these questions to get more information about their low blood pressure, diastolic blood pressure, and how these symptoms could relate to that finding. So right now, I am going to do an abdominal exam, and I'm going to hand the camera off to my cameraman. Okay. All right. So, hi, I'm Matt. I'm going to be performing an abdominal exam. My virtual instructor over here is going to be Dr. Campbell. So I'm going to ask you if it's okay to lie down on your back. Put this on your legs. All right. And then is it okay to lift up your shirt? All right. And then is it okay if I drape your lower body? So first, I'm going to just inspect the general area of the abdomen for any possible, if the abdomen is inverted or exverted, for any herniations. And then I would inspect for any possible lesions, anything to deal with the integumentary systems, any stretch marks. And then if one side of the other is bulging, which could be ascites, and right now I don't see anything, so I'm going to move on to percussion. Actually, auscultation. Sorry. Okay. Yeah, you want to come over now? So I'm going to start in the right upper quadrant. And I'm going to stay in each quadrant for a minute and just auscultating for any bruits or how many bowel movements. It'd be like gurgles. Normal is ranging anywhere from 5 to 34 sounds. I'm going to move over to the left upper quadrant. And I'm going to move down to the left lower quadrant. And we'll move over to the right lower quadrant. Alright. With those findings, I would say that she had normal bowel movements and there were no bruits or anything, so there was no increased turbulence in the arteries. Right now, I could also inspect I could listen in to the abdominal aorta and renal arteries and iliac and femoral, so I'm going to do that right now. So I'm going to locate the abdominal aorta. I can find that. And then I'm going to go off to the sides for the renal artery. And then the iliac artery. And then the femoral artery. Alright, everything is normal with that. So now I'm going to move on to percussion. Starting off in the right upper quadrant, I'm going to start off at the mid-clavicular line. So I noticed that from here it was tympany, and then right here it got to dullness, so I'd say that would be the lower border of the liver. And then I'm going to move over to the left upper quadrant. Just pain with that? And move down. And then move over to finally to the right lower quadrant. Alright, and then next I'm going to start off with light palpation in the right upper quadrant. I'm going to do this with one hand. And I'm going to visualize for any apprehension or guarding by the patient by their facial expressions. I'm going to move down to the right lower quadrant because the left upper quadrant, she had pain with it, so I'm going to do that last. Any pain with that? And lastly, the left upper quadrant. Any pain with that? Yep. So then I'm going to move forward with deep palpation with two hands, starting in the right upper quadrant. Any pain with that? Gonna go down to the right lower quadrant. And then the left lower quadrant. Any pain with that? A little bit. And then finally, I'm going to go into the left upper quadrant. And then I'm noting here that the spleen is in the left upper quadrant. So that could be there could be tenderness with deep palpation as well. And the spleen, while examining, should not expand below the costal margin. So the special tests I chose to test for peritonitis would be the psoas sign. So what I'm going to ask you to do, Haley, is I'm going to ask you to lift up your leg, and then I'm going to apply resistance, and then you're going to resist it. Do that. Okay. 1, 2, 3. Any pain with that? Okay. That test would be negative, and then if it was positive, she would be complaining of pain in the hypogastric area, and you could rule in a peritonitis for that. So after doing the abdominal exam, I'm also, one thing I did forget is that I'm going to look at the abdominal aorta and the width of it. So I'm going to find the abdominal aorta. It's going to be deep. I'm going to palpate it with 2 fingers. And then I'm going to spread my fingers apart. You want to get over here and do it. Sorry about that. So right there, I feel roundness on each of my edge of my fingers. Get lower. Roundness on each of my fingers, and this isn't greater than 3 centimeters, so I wouldn't say that's of concern. All right. So I'll take that out. So with my medical management, based off of this, I would say that I would do an immediate referral to a medical doctor, and it would be urgent without PT. I would suspect that the GI system is involved with possible internal bleeding due to a ruptured spleen, and that the ruptured spleen can present with left shoulder pain, left upper quadrant pain, abdominal pain, and lightheadedness. Also, the deep aching pain could also signal viscerogenic pain pattern. With the patient, I would explain the exam results and explain that the patient's condition would be out of my scope of practice and that I would recommend that the patient sees an MD. I would also let the patient know that PT would not be appropriate today. All right. And I think that is it. So thank you, Dr. Campbell, and I hope you have a great day.